Hello, my name is Claudia Smith. Today, we hope to teach you about psychology, but more specifically, we hope to teach you about anxiety and the current treatments that are available. This is a topic of interest because as a college student, I see myself and many other people struggling with stress and anxiety almost every single day. In 2017, the U.S. Census Bureau reported that over 18 million students were enrolled in college in the U.S. Nearly 3/4 of these students reported that they experienced an overwhelming sense of anxiety at some point. And then, almost 30% of these students reported feeling that overwhelming sense of anxiety in the past 2 weeks. Unfortunately, it makes sense that so many college students are stressed, especially because of how many assignments, tests, and deadlines U.S. college students must adhere to. But the fact that almost 30% of students experience an overwhelming sense of anxiety almost weekly shows that they are probably not informed about all of the available treatments to help stress and to help anxiety.
Hi, my name is Nora, and I'll be going over what is the current state of knowledge with our topic, anxiety. Anxiety affects 18.1% of our population, meaning it affects over 40 million people in our world today. I'll be going over current medications and treatments that will help treat anxiety today. Starting off with our medication, we have buspirone that treats short-term and chronic anxiety. Doctors also prescribe antidepressants and SSRIs that include neurotransmitters that affect mood, muscle movements, heart rate, and many other functions. There's also professional therapy, including group therapy and exposure therapy. Group therapy includes coming together with other people who experience anxiety just like you and going over each other's experience so you won't feel alone. There's also other self-care and self-help methods that include exercise, diet and nutrition, and meditation. There are so many ways to treat anxiety, but these are the most current ones in the world today.
Hello, my name is Charlene Poon, and I will be talking about some controversies that surround anxiety disorders. Anxiety is often underrecognized, underdiagnosed, and may go untreated. Doctors only have the ability to identify behavior that correlates with a disorder in the brain, but not necessarily the cause. Study shows that if parents have an anxiety disorder, it then increases the chances of the offspring to inherit it, emphasizing that the chances increase regardless of the individual parent or due to the combination of the genetics from both parents. We may often have to differentiate between a person being shy or a person who has a disorder. A person that is shy may present a behavior that is still between the normal spectrum, while individuals that have a disorder tend to have a behavior presenting physiological symptoms or are overreactive, which can include but is not limited to feeling nervous, restless or tense, having a sense of impending danger or panic, having an increased heart rate, breathing rapidly, sweating, trembling, having trouble sleeping, or having the urge to avoid things that trigger the anxiety.
Hi, my name is Milena Garibay, and I will be discussing the future of anxiety. So, as discussed, anxiety is an increasingly important topic in this day and age. The combination of anxiety and depression has and may continue to be the main source of happiness robbing and life robbing disorders to exist. The intensity of the subject is, as well as it should be, is being recognized in order to refocus America into the most important topic, which is the mental health of the citizens. So as it is known, the growth of technology has also increased the growth of insecurity and self-consciousness, and what would usually be specifically to teens also now includes adults. The amygdala, the emotional part of the brain, allows people of all ages to be consumed into these thoughts and anxiety. It leaves everyone vulnerable. The seeing and comparing of statuses has also begun at really early ages, being that new technology is being made. So as each year goes by, the younger the generations will be exposed to these type of emotions and anxieties. Another aspect to be a major part of the future of anxiety is the toll of school and the stress of it. Some brains are not as well as equipped as others to deal with the amount of stress that school and setting up for a future may involve. Seeing how much has changed in the generations prior of the importance of school and getting good grades has increased, it can only be imagined how much it will increase and bring along anxiety with it, since students are just getting used to knowing how much they need to know and the stress of being successful at what they want to do, since it's at much higher stakes now. Everyone is in competition. So this is where the next topic can come in, which is circumstances. So it's been a while since America's been in a pandemic, and especially one such as this one where people now don't know if they're losing their jobs, if they can't go to school, or if they even have the virus. Anxiety has gone to an all-time high, especially with everyone at home. There are cases of domestic violence. There are also a lot more cases of depression, along with anxiety, because they're hand in hand, and people being home, not knowing of what's going to happen, increase both of these things. So the previous points that were made discuss the future of anxiety increasing, but what are some tactics that can help anxiety decrease in the future as well? So according to APA Psych, there is a development of mobile apps and for individuals between 5 and 28 years old that help track and treat the mental health difficulties. But as of now, there is not much evidence supporting the efficiency of the mental health app, so hopefully there are alternatives that can help. Another finding in the future of anxiety can be found in the website SpringerLink. Article written by Laura P. Strachan, I don't know if I said it wrong, explains a recent discovery that imagery rescripting, or IMRS, affects memory process and schemas. IMRS can be an effective tool for social anxiety as well as OCD. Reductions in cognitive, affective, psychological, and behavioral symptoms are things to expect with the use of IMRS, and research is still being done on how to go about using this finding along with others to help people of all ages reduce anxiety and receive mental help to better their lives.